Yeah, hi, good morning, doctor. So
Good
today,
morning.
yeah, hi guys. So today we do have Dr. Pushpendra Nath Ranjan. He's a highly experienced neurologist based in South Delhi with an impressive 36 years of dedicated practice in the field of neurology. He's going to be talking about modifiable risk factors of stroke. And so please welcome Dr. Pushpendra Nath Ranjan. Go ahead, doctor.
Thank you. Thank you very much. Namaste to everybody who is here with us on the program. I'm going to, in short, tell you about the risk factors of stroke because I think prevention seems to be the most important and the basic thing for preventing a cerebral stroke. When we talk about prevention, we talk about risk factors which are modifiable and the risk factors which are not modifiable. You and I can do nothing about the non modifiable risk factors, but you and I and the society at large can do lots and lots to prevent these modifiable risk factors. You would be all happy to know. And this information you would disseminate that 70% of strokes are treatable and preventable. So if you're going to look after your risk factors, you are preventing a stroke in a large number of patients. So what are the risk factors which can be modified? I'm sure most of you know, and maybe a repetition for you, but obviously and always, repetition makes things better. What are the modifiable risk factors? One, hypertension. Two, diabetes. Three, hyperlipidemias, high cholesterol. Four, sedentary lifestyle. Five, smoking. Six, alcohol. And one which we have added recently is what is called sleep apnea. This is called obstructive sleep apnea. I will come back to a little later. So we will start from the important risk factors of stroke. The first one being hypertension. I'm sure it must be the experience of all of you. It is sometimes very difficult for a patient to accept and say that he is a hypertensive and he requires treatment. Please, hypertension is an importable risk factor. And if you treat your hypertension, which is not too difficult to treat, it may not be always necessary for you to have drugs. You can control your blood pressure by taking less amount of salt, taking less amount of fatty fried foods, and regular exercise. You can control your blood pressure. The other important thing, which we have seen in our own study, that people, patients, relatives deny that they have hypertension. And once they realize that they have hypertension, they do not take the drug regularly. The answer which you get is if my blood pressure is 140 by 90, it's not high blood pressure. Please do understand that I don't want a 50, 55, 60 years old person to be going around with a hypertension of 140 by 90. That is hypertension, which needs to be treated. And what would you like your blood pressure to be? I would like your blood pressure to be 120 to 130 by 80. And if you are a diabetic with this, we will still like to have it at a lower level. Please don't bother about low blood pressure. Low blood pressure becomes only significant if it produces significant symptoms. Otherwise, 120, 80, I hear it every day. Doctor, my blood pressure is 120 by 80. I got no blood pressure. He has no symptoms. So he wants to stop his anti-hypertension because he doesn't have blood pressure. So the most important thing which I would stress on you is, please take care of your blood pressure. If you have a blood pressure, if you have a younger patient, if you're young, you have a blood pressure, which is essential hypertension, you need to be investigated to find out the cause of blood pressure. Second, most important thing is diabetes. Diabetes is increasing, at least in our part of the world. Stroke is increasing, diabetes is increasing, blood pressure is increasing in a developing world like ours. And that's why the incidence of stroke is steadily increasing in the developing world like ours. Though in the developed world, the incidence of stroke is coming down. In the underdeveloped world, it is taking major way of life. So it would mean that you have to control your diabetes. You have to accept that you have diabetes. Again, as I said, if you have a combination of diabetes and hypertension put together, that is the still more deadly combination for you to have a stroke. Hence, it would mean that you should control your diabetes either by taking drugs, either by physical exercise, or either by improving your lifestyle. I always say that diabetes, hypertension are lifestyle-related diseases. So you have to work a lot in improving your lifestyle. After all, you would ask me, what do you mean by lifestyle-related diseases? Lifestyle-related disease means regular physical exercise, being positive. As you all know, even depression, people who have depression have higher chances of having a stroke. So, good physical activity, eating good, healthy diet, taking antioxidants, which I believe in, would all help for you to decrease your incidence of stroke. The third thing, which is very important, is hyperlipidemias. Now, should you treat hyperlipidemias? Should you leave them on their own? Should you just treat them with drugs? You got high density lipoproteins. You got low density lipoproteins, HDL and LDL. And then you've got cholesterol and triglyceride. Your HDL, which is a good cholesterol, should be high, about 50. Your LDL, which is a bad cholesterol, should be low. And most of the studies, and in our own experience, high LDL increases the chances significant for cerebrovascular disease. So you got to target a good level of LDL, and now they say not above 70, low cholesterol, low triglyceride, a high level of HDL. After all, when you have high cholesterol, LDL levels high, HDL, what does it do? You are accelerating your process of atherosclerosis. What is atherosclerosis? As you age, there has to be a thickness in the arterial wall, which nobody can help. But definitely, with your modulation of lifestyle, with good habits, controlling your diabetes, hypertension, triglyceridemia, you can at least stop the progression of the atherosclerosis. The next, which is very important, is smoking and alcohol. Now, I'm usually asked the question, which alcohol is safe. Is it red wine? Is it white wine? Is it gin or etc. etc.? No alcohol, whether it's red wine, white wine, is safe for a stroke patient in primary or secondary prevention. Yes, you could take minimal amount of alcohol, 1 pint once or twice a week, should be all right. But beyond that, it's going to harm you again. Smoking is the worst. Nicotine is the worst vasoconstrictor for us, and the agent which is worse for cerebrovascular disease. So please, 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 if you are a smoker, please stop smoking. Please don't be in the company of a smoker also, because passive smokers are as bad. Another thing which I will have to stress, don't be under the impression that you smoking today, your chances of having a cerebrovascular disease decrease. No. It would take up to 5 years when you're still prone to have a cerebrovascular disease. The last but not the least, which we have been getting interested now, I had done a study which was published in Cures, very widely quoted study of the chances of post-stroke dementia. In our own study, it was as high as 37%, which is very, very high. And we noticed one thing, which we are going to go study on. The people who have OSA, you know what is OSA? OSA is called obstructive sleep apnea. So I have now started adding OSA as a modifiable risk factor for stroke, which may not have been mentioned in the textbooks. But I think it's very important. You snore in the night heavily, the tongue falls backwards, and you obstruct your airway. When there is a decreased oxygenation at that time, you take a small breath, and then you again start doing the same. We have found dementias, strokes, epilepsies, heart attacks are more common with people who have obstructive sleep apnea. I was looking for a device which I have been able to find when you can put the device on the patient and he's in his house, and you have an AI software. You can pick up if he develops sleep apnea in the night, and you can help him by preventing a stroke. So please remember, if you look after these things, I'm sure you can prevent this deadly disease. The last but not the least, I would say, is the intake of oral contraceptives, where we know oral contraceptives produce both arterial infarctions and venous infarctions. So people who are on contraception for whatever purposes should be very careful, because they could get strokes, more venous strokes than arterial strokes. A word about the non-modifiable risk factor. I and you can do nothing about the age. I and you can nothing about the race. The Asian population is different from the American population. We are made differently. Our arteries are different. We get more of intracranial disease inside the brain. And Americans, Europeans get more of extracranial disease. Last but not the least, we talk about the genetic factors, but these genetic factors come in people in young strokes. So you don't have to bother that much about it, as you have to bother about the modifiable risk factors of stroke.
Thank you so much,
Thank
Doctor.
you so much.
Powerful. I knew a lot of the stuff, but you just breaking it down and explaining it is so great for myself as well as the people around me so that I can share it with them. So thank you for that, Doctor. Yeah,
Yeah,
I did have a question for you as far as the
yeah.
modifiable risk factors. Do you have any like a tip or something to how to increase your chances of modifying those some of those risks?
Well, yes, I would say I would get. I have a very strong feeling that in our country, I don't know, it may not be your country,
Hmm.
that we have a lot of people who are vegetarians, and these vegetarian people have a deficiency of vitamin B12. And if you have a deficiency of B12, you increase your amount of homocysteine. And homocysteine comes in the cycle, which increases the atherosclerosis. So that's one thing which is very important, which is I look for every patient in my country. The second thing, the body is under tremendous amount of oxidative stress. The body is not able to produce as much of antioxidants as it should. So you do require in people who have higher chances of cerebrovascular disease antioxidants, because the antioxidants, it is seen seek to save the endothelial wall, because in a stroke what is happening is everything is happening on the endothelium, and if you can save the endothelium you can save further stroke. Sometimes you also think that people who have high cholesterols, should they be put on long-term statins? The answer to that question, I don't know, and I think it's not been very clear in the available literature.
Thank you, Doctor. That's awesome. Yeah, well, I do appreciate your time today and all the information you shared with us. I'm excited to share this with the community so that way they can, make these lifestyle changes to help reduce their chances of having stroke or with myself having another one. But yeah, I do appreciate your time, Doctor. I do respect
Yeah,
your time, and so I think it's good that we wrap up right now and
yeah.
we'll keep in touch. Maybe we can do some more of these things in the future.
Thank you very much.
All right. Thank you, doctor. Yeah. Have a good day.
Thank
Yeah.
you. Namaste.
Namaste.